Spirometry is a test that allows us to measure volumes of air that move in and out of the lungs. Spirometry can be used clinically or in a laboratory setting as a method of assessing breathing performance. Spirometry is performed with an instrument called a spirometer. There are different types of spirometers. The type commonly used in an anatomy and physiology lab measure the volume of air being moved in milliliters. Some types of spirometers measure the rate at which air is moving in or out, and some types measure both volume and flow. Let's take a look at a few different types of spirometers. This is a dry spirometer. It's used a lot in anatomy and physiology labs. It measures the amount of air being exhaled using a turbine or windmill type device that spins as air moves across it. To take a measurement using a dry spirometer, you have to put on a disposable mouthpiece, set the unit to 0, exhale the desired volume of air into the spirometer, and record the reading in milliliters. This is a wet spirometer. It's also commonly used in A&P labs. Aside from the way it works, the wet spirometer is used in a similar way to the dry spirometer. This device has two chambers. One is filled with water, and the other is an inverted bell suspended in the water. When the subject exhales air, it enters the water-filled chamber and it causes displacement of the smaller air-filled inverted bell. The amount of movement of the chamber is used to measure the amount of air. A type of spirometer used clinically to measure the flow of air is a peak flow meter. It's a device used to measure a person's maximum speed of expiration. Overall, peak flow readings are higher in healthy people and lower when airway resistance is present. Peak flow meters can be used to indicate the onset of a respiratory problem or to monitor a treatment. This is an incentive spirometer. This type of spirometer is used by inhaling into the device. It can monitor flow and measure the amount of air moved. It's commonly used by people who need to exercise their lungs, like post-operative patients that might not want to breathe deeply because it's painful at first. Let's review the various types of spirometers before we do a spirometry experiment ourselves.